Hello, I'm Elain Economou. Lifestyle medicine is a medical subspecialty that uses evidence-based information in 6 key pillars to treat, reverse, and prevent chronic illness and promote whole person health. As a certified Pilates instructor, the pillar I specialize in is physical activity and movement. One of the areas I get many questions about is how to best support pelvic floor health. Many people who struggle with incontinence, constipation, or who are postpartum may need to support their pelvic floor to fully address these conditions. Before we discuss some exercises that can help us strengthen our pelvic floor, let's get to know this area of our body a bit better. The pelvic floor is deeply connected to how we breathe, so focusing on our breath can help us stimulate the pelvic floor. When we breathe, we want our lungs to fill with air to fully oxygenate the body and our trunk to expand three-dimensionally. Our diaphragm and our pelvic floor expand, as do our deep abdominal muscles, so our organs have somewhere to go when we inhale. We want tone and coordination in the system for our pelvic floor to work optimally. We breathe somewhere around 25,000 times a day, so there are plenty of opportunities for the system to be stimulated. Our pelvic floor is in your pelvis, and it's a busy place. Your leg muscles connect, your abdominal muscles, your glutes, and the muscles of your low back are all nearby. And because of this, there are synergistic contractions and stimulation to your pelvic floor when we move. For a variety of reasons, this system can get out of balance and we lose tone and responsiveness. We could be overusing some muscles like our glutes, which might happen when we are worried about incontinence, or we could be sitting a lot, which brings stiffness and compression to the area. Regardless of why you might need to bring tone to your pelvic floor, the following exercises will be helpful in bringing some organic stimulation to the system. The exercises I'll be showing you today are gentle enough that you can do them every day. They should not cause any pain or discomfort. If you do experience pain and/or some discomfort, seek the help of your healthcare provider immediately, and always seek your doctor's permission before starting any new exercise routine. Today's exercises will be done sitting and standing. For the sitting portion, use a comfortable chair or stool without a thick cushion. Think of a kitchen or dining room chair versus an easy chair or the couch. When standing, use your chair for support or position yourself near a counter or sturdy table. Be sure that you have plenty of space around you and that your chair is on a non-slip surface. Also, you can do these exercises with or without shoes on, whatever is most comfortable for you. Please also have a rolled bath towel handy. We will use it as a prop. And this is how you can roll it up. As we use it, you might need to unroll it a bit or roll it into a way that works for your body. I'll talk you through what to look for. Let's get started. We will start with our breathing abs. Start by sitting up with your feet flat on the floor. Take a few breaths here and notice the sensation of your feet on the floor and your seat on the chair. Imagine you are rooted from your feet and your seat into the ground, and you have a tether pulling the top of your head up and your spine long. Breathe gently in through your nose. As you do, notice where your breath is impacting your rib cage. Think of expanding side to side in the ribs. You can place your hands on your rib cage to feel them move, and try this for 3 breaths, breathing in and out through your nose. Now, take your hands to your low belly and add what I call a party trick. Inhale as you did before, and on the exhale, blow gently out your mouth and pull your belly in away from your hands, feeling your abdominals pull in away from your hand. Do this 3 times. Inhale, exhale, and pull your belly in. Inhale. And exhale. And pull your belly in. One more. Inhale, feel your ribs expand. And exhale. Pull your belly in. If you feel your belly pushing out or feel like you're bearing down into your pelvic floor, it's important to stop here. Keep trying to gently pull those abdominal muscles in, and if you feel anything, it's a lift in the pelvic floor. Try to just move onto your hands. Keep your shoulders easy, eyes on the horizon, with no other gripping in the muscles. So next, we will add the towel between your knees and do the same breathing exercises with a gentle squeeze on the towel. This will help engage your pelvic floor. So you inhale, exhale, squeeze the towel, pull the low belly in. 2 more. Inhale, exhale, squeeze the towel gently, pull the belly in. 1 more. Inhale, exhale, squeeze the towel and pull the belly in. Keeping the towel between your knees, let's move the spine. First, we'll do side to side one-arm stretches. Keeping both sides of your waist long, take one arm, the other one can go on the chair, lift it overhead and stretch to the other side. Moving and breathing as you move. Other side, inhale and exhale. You can pull your belly in and have that gentle squeeze on the towel. Inhale, exhale. And last one, inhale and exhale. Next, we'll do a side stretch. So one arm is long and we're trying to lengthen your waist and your back. So you'll stretch, inhale, up to the sky and relax. And inhale and relax. Inhale and relax. Last one, inhale, yawning through the body and relax. Next, we will spiral your spine. Start with lengthening your arms out to the side, and we're going to rotate to the right, keeping your eyes on the horizon and hugging those abdominals to your spine like you're wringing out a washcloth. Repeat on the other side. And one more set. And if you're feeling any gripping in your hips or discomfort holding the towel, set it aside and try again another time. Flexion. Push your feet into the floor and pull your thighs like you're pulling them away from your body to feel your spine flex. This traction will help stretch the low back and then release. We're going to repeat it 4 times. Exhale, push into the floor, traction those thighs, curl your low back, and inhale to come up. Hug the towel if it feels okay. Exhale. And inhale. And last one, exhale. And inhale. Extension. Hands behind your head for extension. You're going to rest your head into your hands and lift your chest up to the sky with your elbows reaching wide. You can inhale here. And then just exhale and come to upright. 3 more times. Inhale. And exhale. 2 more. Inhale. And exhale. Last one. Inhale. And exhale. Reach your arms up and rest them down. Next, we will move to standing with a chair nearby for support. Find a comfortable stance with your knees soft. First, shift your weight from side to side, just noticing your feet on the floor. You can do that a few times, and then we'll add figure eights. Shift to one side and think about circling hips and shift to the other side. Circle and shift. Circle and shift. Circle and shift. You might feel a stretch in your hips and back and maybe even into your pelvic floor. Finally, take a whole body stretch with both arms overhead and inhale. Then exhale, lowering your arms and stand still for a moment, bringing awareness and appreciation into your body. That concludes our series of pelvic floor exercises. This program can be done at least once a day as part of a healthy pelvic floor and healthy body routine.
For more information about Trinity Health Ann Arbor's lifestyle medicine program, please visit trinityhealthmi.org/THAA Lifestyle Medicine.